Project 3 Clinical Decision Support Systems video presentation of the functionalities of our electronic health record system. Functionalities are the range of operations that can be run on a computer or other electronic systems such as our electronic health record system. In our system, we've incorporated a patient table, a patient education table, a visit table, prescription table, and a vitals table to help us aid in the functionalities of our system. As you can see here, I've pulled up our patient form with Miss Patty Cruiser. From here we have many different functionalities. We can scroll down here to the bottom and it can have a smoking status, which is a yes or no answer. The doctors can come in here, check smoking for yes, or don't click anything for no. So we have Miss Patty Cruiser. It's a non-smoking patient. And then next here we can run a visit report. By doing so, this shows us all the visits that she's had in her office and what date she came in and what was her diagnosis that day she came in. We can go back to patient form. We can then click a Run Prescription Report. By clicking this, it gives us the date the prescription was written, the drug name, and whether or not we gave refills or if generic was allowed, and what pharmacy we wanted it called into, or the patient wanted it called into. We'll go back here to our patient form, and then we can click a Run Vitals Report. We click this, and this gives us all of her vitals that she's had each time she's came in, such as her weight, her blood pressure, and her pulse. This allows the doctor to go back and look in to see if maybe one time she came in and her blood pressure was fine, the next time she came in and it was elevated. They can keep track of this so that if her blood pressure does stay elevated each time she comes in, they could then possibly diagnose her with hypertension, high blood pressure, and possibly put her on medication to help control that. Then we'd go back here to patient form, and then we click down here on our next functionality is check alerts. Okay, this here, Miss Patty Cruiser, is a female. For some of these alerts, you have to be either male or female, or you could be both. It just depends on what alerts pops up. So we'll go down here, check alerts. It alerts us to patient needs a colonoscopy, which is for male and female, 50 or older. And then it alerts us to patient needs a mammogram, which is only for females, 40 and older. And then it alerts us to patient needs an immunization for pneumonia, which is anyone from 1 on. It also alerts us that she needs a flu shot, and alerts us that patient needs a cervical screening, which is only for females 18 and older. Then I'm going to go back here and click back to my other patient. Here we have Mr. Mario Speedwagon, a male. If we go over here and click check alerts for him, it's going to alert us that he needs a PSA testing, which is only for males 50 and older. It also alerts us he needs a colonoscopy, which we know that is for 50 and older, male and female, and alerts us that he needs a pneumonia vaccination and needs a flu shot. We can also scroll down here on our forms. It goes down here to our visit information. Since when he came in, he had acid reflux. What we can do over here in our next functionality, we can go over here and click Patient Education Report. This is going to bring us to the patient education sheet, and it gives the diagnosis name, which is acid reflux GERD. This here is just an overview of their condition that the patient has, and it gives them some educational literature for them to educate themselves also on the disease that they have. and what they can do to help maybe possibly relieve the symptoms that they're having. We can also go back here to our patient form. We have all the visit information. And scroll down here. Also gives us the prescriptions, which we can go back and forth through, which ones they had on what date. And the same also down here for the vitals. It gives us the vital signs. And that is it on our functionalities for clinical decision support systems.